some parents might insist that kids are still going to be kids when it comes to getting glasses. I mean, I get it. But here's the thing. Early myopia management isn't just about clearer vision today. It's really about safeguarding their eye health and also their vision for tomorrow. I'll share how I get parents on board with myopia management and how you can do it proactively so that we can save the eyes of our young, precious little ones. Hi there. So my name is Shafiq. I'm an optometrist. I've been actively practicing myopia management for the past 5.5 years. I know what it is like to start off as an optometrist or eye doctor, not knowing how to effectively manage myopia. So here I am just sharing all my experiences with you guys so that you guys can benefit out from it. And also, of course, we know by the year 2050, there's going to be a lot of people who are going to be short-sighted. And if we as optometrists and eye doctors can do anything to bring that down, that is going to be great. So I'm going to dive straight into it today. And the first thing that usually that I would tell parents is that, look, their myopia can accelerate very quickly, especially if no myopia management is started. So I guess it's just about getting them to understand as to why we want to do it early. If we do not manage their myopia while it's still pretty low or on the early onset of it, it can actually project up to be pretty quick. So for instance, someone who's maybe 8 years old and they're already a -2, they might be projected once they're about 15 or 16 to maybe be like a -4 or even a -5. But hopefully with myopia management, we can bring it down to potentially maybe just a -3 by the time they're 15 or 16. So just trying to get parents to understand that, look, we're not here, to just sell you some fluff, but we really want to help you to help your kids so that when they grow up to be a bit older, their eye health is going to be okay overall. Now, secondly, is that because we want to keep their prescription for spectacles as low as possible. So we need to emphasize the desire to minimize the need for stronger prescription overall. If we are able to keep their prescription low, this is going to help them out in so much ways. Number one, in terms of them buying glasses itself, they do not need to go for what's called high index lenses. As you guys know, these lenses usually cost much more than normal glasses. So if we can help them out, in any way, even to save some money on their glasses, that's going to be great. And yes, I know contact lenses wise, it usually doesn't really matter how high you go in terms of the prescription. Unless it has astigmatism, the cost is usually about the same. But let's say if our patient here is someone who wears glasses and maybe every year or two need to get a new pair. Now, it is going to cost quite a bit if, let's say, they are like -6 diopters or 7 diopters of myopia compared to someone who's just a -150 or -2 diopters of myopia. And of course, this is not talking about like the lifestyle that they can lead. We know that someone who has lower myopia, they probably sometimes can get by without glasses from doing their day-to-day. But if they have a substantial amount of myopia, especially high myopia above -6 diopters, that is quite a bit. So we want to try to help them out as much as we can. Now, the third point I'm going to talk about is actually the potential future risks for things like retinal detachment, glaucoma, and also myopic maculopathy. Now, it goes without saying, we know that the risk for all these diseases or all these conditions that I have mentioned does increase with the increasing myopia that someone has. So, while a child is still young, we want to try to manage it as much as possible. And trying to get parents to really understand this is actually really important because they just see their kids now wearing new sets of glasses, that's it. They don't see that their kids, once they grow up to be much older, that they might need, to have all these different treatments done. So for instance, if they have something like a retinal detachment, they have to go to the hospital to get it fixed. Do we really want that for our child? I mean, if it was my kid, I wouldn't want it. And I'm sure a lot of parents out there also do not want it. So it's on us as optometrists and eye doctors to be able to convey that clearly to our patients. Secondly, like glaucoma. Glaucoma is a condition that we know does affect peripheral vision. It does start from the periphery and it goes inside in more advanced stages. and that will result in a tunnel vision. We do not want anyone to be going through or having to have glaucoma and getting worse over time, because glaucoma is irreversible blindness. At least with retinal detachment, we know that they can go to get their eyes fixed in a way where if it's a detached retina, the ophthalmologist or the surgeon can basically patch it back on in a way. Even if there's like holes or tears, hopefully it's not too near to the macula, but it can be patched up. But we know that for glaucoma, it's irreversible blindness. Once someone has it, there's no way for them to get back that vision. So we want to be able to help our myopic patients to not get that. Next thing is the myopic maculopathy. Now, myopic maculopathy is basically just a degeneration that is caused on the macula due to myopia. And we know that in myopia, what happens is the eyeball is stretching. It's stretch and stretch as your prescription goes higher. The axial length of the eye is longer, and hence with the thinning of the retina, it can cause maculopathy on the macula itself. And this is not something that is good, because why? It can eventually affect their visual acuity, which is their VA, and it might drop from maybe 6.6 or 20/20 to maybe even like 6.9 or 20/30. So that is something that's not good. And of course, we want to be able to convey all this to parents so that they do understand. Hey guys, real quick, I understand how it's like, educating yourself whether you want to manage your patients or refer them off. So click on the link in bio down below. You won't regret that you did it. Now, the fourth thing I'm going to talk about is the impact on quality of life. I briefly touched about it just now, about how their daily activities, these kids, it will be affected. Now, parents always see that, their kids are still young. So at most, they're like in school, maybe on the weekends, or maybe, they do play soccer, basketball, swimming, and all this kind of things. But the thing is that the convenience of not needing to wear glasses all the time, especially when they're older, is huge. Now, when they're young, now parents see it as sports, okay? So if let's say their kids are active in sports, they definitely want their kids to be able to be a bit more mobile. And we know kids and glasses running around with it is not the best way. It's not the best way for them to be able to move around and navigate. I know for myself for a fact that back when I was in school, it was really hard for me to play basketball when I had my glasses. But because I did not use contact lenses back then, I only used glasses. I was sweating, and sometimes the glasses slip off my face. It goes down, goes up, the lenses itself. And there are more than a few times that the basketball itself did hit my face and bend my glasses out of shape. So these are all the things that happens when your kids are basically, or not your kids, but your patients' kids are basically going through on a day-to-day basis. So sports is definitely going to be challenging for them. Any kind of sports, not only basketball, but like the ones I mentioned, even swimming. And for girls, if they're doing like gymnastics, that can also make it a bit more challenging. So we want to take all this into consideration and let parents know as to why they really have to take myopia management seriously at a much younger age. Now, as your kid starts to grow older, let's talk about when they reach the legal age for driving. Here in Australia, by the time they're 16, they can learn to drive. Now, if they have low myopia, and we're talking about maybe minus 0.50 diopters or maybe minus 0.75 diopters, they might be able to get by without wearing glasses. Now, but if their myopia is above minus 1 diopter, or their vision basically with both eyes, if they're seeing worse than 612 or 20/40, here in Australia, they have to wear prescription in order for them to be able to drive. Now, so we can see how that can be a bit of an inconvenience for some of these kids in a way that now they have to wear glasses when they're going to be driving. So they always have to have a pair with them. And of course, if their vision gets worse enough, they do have to wear the glasses full time. All right, so those are just some things to take note of. Now, of course, when they get a bit older, sometimes they might be a bit more vain, or sometimes they just want to go out with their friends. So they might actually prefer to wear contact lenses. And now parents have to think about it. When the kids are not maybe working yet, or not being able to afford all these different things, they would have to now pay for glasses and contact lenses. So just think about that, the financial burden of it, like everything is just really bad. And the next thing also is about enforcing them about the role of outdoor activities and near work. They know their kids better than us, for sure. So one thing is that with parents, they know that, if their kids are spending too much time just cooped up in front of the computer screen, I understand, be it for like school, or be it for the day, maybe play games quite a lot. That's another issue that we would maybe have to challenge in a way. But also not spending enough time outdoors where their eyes can relax and look far away, that definitely does play a part into this whole thing. And of course, the last thing that I mentioned, that I'm going to mention, is the academic performance and daily activities. So this is just to address about how myopia can really impact a child's academic performance in school and also their daily life. Now, if the kid is someone who would voice out and would say that, hey, mom, dad, I can't really see too well, can you bring me to an optometrist? That'll be great. But most of the time, that's not what happened. Most of the time, what happened with kids, initial stages, at least when they get myopia or their vision gets worse in their glasses, is that they'll maybe just try to move a bit closer to the board in school, or maybe just try to copy off their friend when they have to copy something off the whiteboard in a way. And we can see that all these different things, where the child just try to cope with it. Sometimes they might get a bit of headache. Why? Because they are just straining their eyes, trying to see something as clearly as they can. So we can see how, it will affect how they're in school. And now, of course, when they cannot see clearly in school, it is going to affect how they're going to perform, how well they're going to be doing the exams, how well they can maybe memorize some of the things that they have to memorize. So all of this does play a part. And sometimes when kids are not doing well in school, it might be their vision. It might not be a processing issue, like as simple as getting glasses. That might be all that really can really solve the issue for them. So if we do not take note of this when they are still young and while the prescription is still low, imagine what's going to happen as it gets worse over time. And again, just to talk about daily life, in terms of doing day-to-day activities, things are just going to get more challenging for them. From maybe, not able to easily read a book, to not able to see the meal that's in front of them, or even not be able to watch the TV. Although I do understand these days, kids are much more on their laptop or their computers and their phones and their iPads much more than TVs. And funny thing these days, I actually encourage parents to allow their kids to actually watch the TV because it is a bit of a distance, it is a bit further away. And I think that it's overall a bit better compared to just if it was to be a bit too close with all the screens that they have. So those are what I would do personally when I talk to parents. I'll let them understand all these different points so that they will know and really take into consideration all these different things, and that so they will be able to give what's best for the kid, and also for us practitioners, eye doctors and optometrists, for us to be able to start myopia management as early as possible for our patient, if possible, on the first sign of myopia, or even if you can do anything preventative prior to that, to be able to advise our patient to spend more time outdoors and also to reduce time on screens or to take more regular breaks in between. I think we're doing our job very, very well.